Okay, so let's talk about more of the facial muscles. I don't think there's a equivalent picture of this in the OpenStacks. And again, that's why I uploaded those Martini slides, because sometimes they have really cool perspectives that are useful, but you don't really get in the OpenStacks version. So we already covered the orbicularis oculi, and oculo referring to eye, nasalis, not only the bone, but also a landmark meaning nose, and the levator labii superioris. So this might be a new word, this labii. So this comes from a Latin term. So labia, lips, right? So this is what it's referring to. Levator labii is referring to the lips. And whenever I present this, there's always some little like giggles in the audience. Yes, there is another anatomical labia, but we don't get into that until the next semester. We're talking about these lips, right? This labia, our labia does refer to lips in Latin. Then there's orbicularis oris, and again, oral refers to the mouth. And then you have the levator anguli oris. So oral, both things have oris, and that's just a little more different way of conjugating the Latin to or from oral. And then mentalis, hey, remember those anatomical landmarks, mental? So that's where it's cut in this. That's why you can kind of see this little cross section. But hey, the mentalis is right here on your chin, that mental landmark. And then you have the omohyoid again. Omo is actually referring, a Greek term referring to the shoulder. And again, you have your hyoid here. Notice it's running all the way from the hyoid to your shoulder. So yeah, so that's what we have. So this, what do you have here? It's not only about bones, but also sometimes you have anatomical landmarks in the name as well. And let's go to the next top hat question. The opposite antonym of major is, and I'm not trying to trick you with this one. Okay, that was easy. So it looks like most of you got it. So antonyms. So the opposite of major is minor, and all of you are correct. Nothing major, it's only minor, right? So this is why I'm also bringing that up. Now, thing is that when you're studying these muscles and just looking at the names of these muscles, thing is that remember our general rules of the muscular system? This is a very unofficial one, but I find it useful when I'm like trying to study and name muscles. So if part of a muscle name has an antonym, aka an opposite term, a direct opposite, then a muscle usually exists with that opposite name. Not all the time, but most of the time, if there's a major, there's a minor. So if there's a zygomaticus major, is there just a major? No, it's comparing it to something else, right? So that's why you have a zygomaticus minor as well. So usually when you have a word that has a direct antonym or opposite, usually there's another muscle that has that same root word somewhere else in it, but they just flip that to the opposite term. Now, why do I bring that up? So you have your levator labii superioris, and you have your levator anguli oris. Now notice, what do they have in common? Well, one has labii, one has oris. So one's referring to the mouth, one's referring to the lips, but they both have levator, right? So let's go back to top hat. Now we had our little warm up. Now let's start our next question. So levator sounds like elevation, right? So what's the opposite joint movement of elevation? So levator does come from elevation. So we're talking about those joint movements in chapter 9. What's the opposite movement of elevation? And let's see what most of you said. Most of you said depression or some variant of that. And again, most of you are correct, even though it's showing only one correct. Yes, you are correct. The opposite direction joint movement of elevation is depression. Now, why do I bring that up? So there's a levator anguli oris, and if you think about that unofficial rule of opposites and antonyms, then there must be a, so this is a levator anguli oris, and notice that it's pulling up. So remember, it contracts, so when it does that, it causes you to smile at least a little more naturally than that risorius. But if there's a levator anguli oris, if we use that opposite rules, there's also a depressor anguli oris. So notice that the levator anguli oris pulls up and elevates the corners of your mouth. That's what it's talking about. But the depressor anguli oris, notice that it's in the opposite direction. So it's going to cause that frown, right? If you kind of like depress the corners of your mouth and pout. So levator and depressor, and let's go back to here. And another top hat question. I know I keep on throwing you back to that, but what I'm getting at here is like I'm really trying to reinforce this concept. So hopefully everyone gets this. The opposite anatomical direction from superior is Again, not trying to trick you here. Think all the way back to the first chapter. Okay, let's see how everyone did. So most of you said inferior or some variant thereof, and most of you are correct. Now, why do I bring that up? Okay, I bring that up because, again, you have your levator labii superioris. So notice that it's not at the angle of the mouth. Now it's talking about the lips. So this is, when it contracts, it's going to bring your lips upward this way, right? But the opposite of that is not, now you have two opposites. Opposite of elevation is depression, but now you also have the opposite of superior. Notice that compared to the labii, the levator labii superioris is superior and above your lips. But the depressor labii inferioris is not only depressing, it also is inferior to your lips. So that's the cool thing about knowing these directions and antonyms, is that sometimes you have these paired muscles that have direct opposites. So the thing is that many muscles have anatomical directions in their name. That's what's really cool. So sometimes you have opposite actions like elevation and depression here. But the thing is that you also have superior in this case with the levator labii superioris, but you also have the opposite with depressor labii, but inferioris. So that's why, like, it's an unofficial, don't say it's like the third rule of anatomical naming, but it is something you kind of get 2 for 1. That's what I'm getting at here. Sometimes it saves you, it's a little shortcut that can help you make a best guess at where a muscle is, even if you've never seen the muscle before.